I woke up in the hospital like 3 weeks later, not knowing where I was, not knowing what happened. I was shot 3 times.
The person that was driving lost control of the car, and so my body landed on the center divider, was ejected out of the vehicle.
We began to engage him in the gun battle. During that gun battle, I was wounded. I was shot in my leg.
We had crashed into a tree. The van started spinning like 5-6 times.
And the moment I got out of the car, a car hit my car full speed. My car hit me and plowed into the 2 other cars in the fender bender.
There was nothing I could do to avoid being hit precisely where I sit on the left side of the vehicle by this very large truck.
Drove home, stopped at a light. I guess someone hit me. I don't really remember it.
You have to be prepared at any moment, any second, to take anyone in with only one intent: to be sure the person that is hurt and injured that is coming to your emergency room will leave your door with the best outcome.
I was at the hospital for 3 months.
54 days.
I was in there for 11 days.
2 months.
I was in the hospital for a week.
5 days in intensive care.
I was in for 34 days.
Of the 15 trauma centers in LA, we are the second busiest trauma center in Los Angeles County.
It truly is a team effort. You've got all of the ED staff, you've got pre-hospital, the paramedics, the physicians, the nurses, you have blood bank, pharmacy, the OR, radiology, all the diagnostic tests, all the staff nurses, social worker, care coordination. None of us can do it alone. We have to function together and we have to work as a very cohesive team.
We had those amazing physicians and nurses and techs and skilled people that could go to any hospital, anywhere. And they're here because they care. This is where their heart is. They want to take care of this community.
It was the night of the Rams-Cowboys playoff game. The hype of the playoff, dealing with the rain.
We were soaking wet, dealing with the tarps full of water, and just a long, long day.
Hours after the game, we walked out to the parking structure and said, "See you in the morning." And we were supposed to see everybody back here at 8 o'clock in the morning.
I don't remember anything for like the next 2 days.
Sitting at a stoplight, the route that he goes home every day, there's a car going this way and then a car going this way, and they hit and a car flipped over and landed on Danny's driver's side.
269 on scene.
At the time, I believe his vitals were pretty stable, but that's why it's important for us to get them to the CAT scan, get the x-rays done like immediately. Traumas always take priority. So, and that's when we saw what was really going on the inside. It just hadn't manifested outward yet.
Chest x-ray showed that the left side of his chest was basically very elevated, and it looked like his stomach was up in his chest. So at that point we knew that we were dealing with a more severe injury than we'd been led to believe.
I get here at right around 9 o'clock and Juan calls me and says, "I don't know if you noticed, but Danny's not here." He said that he had been in an accident and that he was in California Dignity Hospital, and we didn't know anything more than that.
He had a diaphragmatic rupture and his stomach was up in his chest, as was some of his small bowel, and his spleen had a tear in it and there was some bleeding around the spleen. So he needed to go to the operating room emergently. We decided not to do a splenectomy and went through the rest of the abdomen in the normal methodical way that we do and didn't see any other injuries, so closed him up. And then because we'd been in the chest essentially through the diaphragm, he needed a chest tube. We knew that he had a pneumothorax on that side, so we put in a tube thoracostomy, and he went to the ICU and did fine.
We're planning an attack on what could be the biggest week of our lives. You know, hosting the NFC Championship game for football is the biggest event that you can host in an NFL stadium. That's not the Super Bowl. So walking in there, it was this weird flood of emotions. Obviously, the first thing is, this is our friend. You know, work aside, it was nothing but. It's really hard to describe. It's really hard to describe. We were scared, just absolutely scared.
And it was the very first day, and he wanted to talk so badly, but he had a tube down his mouth. So he was making sounds and then choking, and so he wrote, "Did I hurt anyone?" He was just so scared that he hurt someone, and that's when he started crying. It wasn't even about himself.
He was intubated with a tube down his throat because of the injury. Once he was extubated, the tube was removed. We needed to see if he was able to eat and drink by mouth safely.
So we do the bite test, and then I felt the pain, and so we asked for another x-ray, and they saw the fracture in the jaw.
My doing any surgery on him had to be postponed until the thoracic surgeons, general surgeons, trauma surgeons had gotten all of his life-threatening injuries repaired.
I really didn't want my jaw wired shut, and everyone just said, just do it. It's better than letting it heal in the wrong place and your bite being out of placement forever. So
I'm thrilled at the outcome, and we were able to avoid a surgical procedure to re-break his jaw. It would have involved 30, 40 visits to the dentist. You know, it would have just been an enormous amount of time and money for him. The surgeons here stabilized his condition, which allowed me on about the 3rd week to treat him, because 4 weeks into his injury without setting his jaw in the right place, it would have been too late.
Now, you'd be hard-pressed to know that anything happened. He's healthy, active, he's Danny. And that's probably the biggest compliment anybody can give. He's just Danny.
Here at the Coliseum, we dispatched to California Hospital. They're really good at what they do, and they care so much. So I'm really happy that they're the ones that we transport to first. They're there for you, and they really do care about not only the patient, but who they're there with. For the care that he got from the hospital, he wouldn't be here without that.
Thank you, California Hospital, for saving my life. I really appreciate it.
Thank you, California Hospital, for everyone from the chief trauma surgeon to the nurse's assistants, for making sure that I was so well taken care of in my most significant hour of need.
Thank you, California Hospital, for saving my life.
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 Thank you, California Hospital, for giving me back my leg and my life. Thank you very much.
When you are hurt, we are here for you.